Hello and welcome to my YouTube channel. Today I'm going to be talking about 10 causes of chest pain. The list is by no means exhaustive, but I think you're going to learn one or two things from these causes I'm going to mention in this video. Number one, costochondritis. Now, adjoining the mid bone, okay, the ribs are connected to this bone called the sternum by cartilages. So if you have inflammation at the point of joining the ribs to the sternum, you could have chest pain called costochondritis. Number two, muscular strain or overuse. If you engage in some form of exercise or activity that results in excessive use of your chest muscles, you could have chest pain. Number three, trauma. If you had an impact or an accident, road traffic accident involving your chest, or something fell on your chest, any form of trauma or the other could result in chest pain. Number four, pleurisy pneumonia. When patients have pneumonia arising from viral infections, bacterial infections, and different forms of infections, the lung tissue becomes inflamed and sometimes can also affect the adjoining tissue, which is called the pleural membrane. The pleural membrane are in two parts. There is the inner pleural membrane that surrounds the lungs, and then there is the outer pleural membrane that lines the chest wall. Usually between these two pleural membranes is a thin layer of fluid that allows these two layers of membrane to glide or slide over each other without problems. But when there is an infection, there is an inflammation, these membranes become inflamed, and so you have what's referred to as pleurisy. And so when the patient takes in a deep breath, patient feels a sharp pain on the side, particularly at the sides. That's called pleurisy, and that could be a cause of chest pain. Number five, pericarditis. Just like you have the membrane that surrounds the lungs, you also have a membrane that surrounds the heart. If that membrane becomes inflamed, that membrane is called pericardium, and if it becomes inflamed, that name is called pericarditis, and inflammation will result in chest pain. Typically, this patient will get some relief by leaning forward. If that happens, that's one of the telltale signs of pericarditis. Number six, esophageal rupture. Now, the esophagus or the gullet is the tube through which food that we swallow goes all the way from our mouth into our stomach. Now, if for any reason there is a rupture or an opening of the esophagus, perhaps from medical procedures like endoscopy or drinking something that is very caustic or acidic, resulting in a tear or an opening or rupture of the esophagus, that can typically also present with chest pain. Number seven, pulmonary embolism. Now, for some reason, if a patient is either overweight and sedentary, has had a recent surgery, is on hormone replacement therapy, or anything that increases the tendency of blood to clot, there could be a situation where a blood clot forms, usually in the deep veins of the lower limbs, and then the blood from the lower limbs typically will come through the heart into the right atrium, the right ventricle, and then pass on through the pulmonary artery into the lungs. Now, when it gets into the lungs, there are very tiny vessels there, and so this blood clot may actually block the blood vessel in the lung and result in what's referred to as pulmonary embolism, resulting in chest pain. Number eight, tension pneumothorax. Now, I've already explained to us that around the lungs, you have the two membranes, what's called the visceral membrane and the parietal pleura. Now, I've mentioned that there's just a thin layer of fluid in between these membranes. If for any reason there is an opening of that membrane, allowing the air to get into that membrane and that air becomes trapped, that is referred to as tension pneumothorax. So you have air coming in but can't go out, and that can cause severe pain and can be life-threatening. Number nine, I'll take number 9 and 10 together, angina and myocardial infarction. Now, I've said that if there's a blocked vessel in the lung, it results in pulmonary embolism. Now, in this case, for the heart, if there's a narrowing of the blood vessel that supplies the heart muscle, that's called angina. However, if there's a blockade of the blood vessel that supplies the heart muscle, that's myocardial infarction. So both of them will present with chest pain, but the chest pain of myocardial infarction is very, very severe. In fact, sometimes you could hear a patient describe it as though a truck were placed on his chest. And because of the damaged heart muscles, it can be potentially dangerous and life-threatening. And so these are some of the causes of chest pain. And so in the lungs, you have pulmonary embolism caused by blockage in the blood vessel. In the heart, you have myocardial infarction caused by blockage in the blood vessel. I hope you've learned something. If you have, do subscribe and share. Thanks. See you again.